All right. Good morning, PTNI's Daily Show. My name is Alan, coming to you from CrossFit Tour West in Fenton, Michigan today. Little change of pace for me. Normally I'm in the car in the mobile studio coming at you at 8:30, but this is a shout out for all the early birds. Figured I'd get a change of pace in here for this morning. Normally I talk about organizational development, kind of how to manage an organization and leadership. Going to do a fusion today of that, fitness, athlete, and population health. So talking to my good friend Eric Chaconis, you know him, he teaches our extremity course. Sorry, I'm not sure where to look. My camera, I'm not normally in side view, so I'm having trouble of where I'm supposed to actually look, so forgive my gaze. So Eric said, hey, you never do anything clinically. You're always in your car kind of just waxing philosophical. I want to see you be more in your natural environment. So here I am at the gym, just finished the 5:45 workout. So today we're going to talk about the millennial employee. You know millennials, you might be one. Most people seem to hate them for one reason or another. Too much Instagram, too much social media, not enough time outdoors, all that kind of stuff we hear about millennials. So who are these gosh darn millennials? Why does everyone hate them so much? We've talked a bit about them before. We've talked that they're now the majority of the population in the workforce, right? So if you are a clinic manager, a clinic owner, if you are hiring people for pretty much anything, you're gonna be hiring millennials. So as we've talked about here on Thursdays before, deal with it, right? So they're here to stay. I say they, I guess I'm on the back end of the millennial generation, born in the early to mid 80s. So technically, date-wise, I'm a millennial too. So we are here to stay, I should say. So what else besides the fact that they're the majority of the people in the workplace? Now, what else should we know about them? You should know, and this isn't meant to be a student loan talk, but you should know that they're buried in debt, right? So not a lecture on student loan debt or the cost of higher education or anything, but we'll hit a few points here about the PT student loan debt and student loan debt for millennials in general. So 75% of PT students have over $75,000 in debt. That's a lot. 25% have more than $150,000, which is even more, right? So that's a lot. So at $150,000 in debt, your monthly loan repayment is somewhere around like $1,900 a month, which I think it's good to know those numbers as a clinic manager, clinic owner, to kind of understand, you know, why do these millennials come to me asking for $80,000 starting salary? Who do they think they are? They are people that are spending, 25 to 50% of their post-tax take-home pay on their loans, right? They need as much money as possible, not because they're greedy, but because they have this giant loan payment that takes away most of their money every month. 45 years. 45 years is the average amount of time the average American will take to repay their student loans. So if you are a PT student and you're graduating between 25 and 30 years old, depending on if you went into another career first or even later than 30, you are going to be about to retire by the time you pay off your student loans on average. So that's something to keep in mind. And with that, we see downstream effects on the workforce, right? We see that most people, yours truly, most of you watching this as well, have a second job. It's at nights, weekends, PRN, travel, home health, some sort of side hustle at the gym, something. A second job, maybe a third job, right? I've got 3 jobs. Most of you probably do too. So if you're a clinic owner, clinic manager, someone that graduated a generation before, you need to understand that that's why your younger employees are racing out of the clinic every day and not doing their darn documentation. They aren't lazy. They don't hate you. They just have to get to their second job, right? Or their third job or their fourth job. They are very busy. They need flexible time. They need to be able to do that documentation on the weekend. Jeff and I do consulting with different clinics, helping them kind of shore up their organization and leadership practices to kind of fine tune and make their clinic more efficient. And we see a lot that clinics have kind of hard and fast rules that documentation has to be done before you leave, or documentation has to be done by 7 p.m. And that dog's just not going to hunt with a lot of younger employees, right? They've got to get to that second job. They've got to get to CrossFit and get coaching they've got to get over to the hospital and work second shift. They've got to go and do a couple home health visits, right? They can't stay at the computer until 10 p.m. at your clinic getting all that documentation done. They've got to push that to the weekend. They've got to have some sort of flex time in the morning or the middle of the day or something if you want that done in a timely fashion. So all of that makes millennials seem really lazy and non-industrious, but really it's not that they're lazy, it's that they are busy, right? It's the opposite. And moving on from kind of the student loan financial talk, something else that really defines the millennial generation is that they're very interested in experiences, right? So we just had the Rising Tide Conference last weekend in New Mexico. Very, very different take on a conference of PTs than what we're used to, right? More about getting outside and rock climbing and trail running and practicing handstand walks in between lectures instead of sitting in a hotel conference room in a shirt and tie, right? Very, very interested in experiences. If you use Airbnb like me, something you've seen on Airbnb now is not only do they sell you a room, but they have experience button now. So not only can you get a room somewhere, but hey, for an extra $50, Jim down the street runs a skydiving business, and if you get in a couple hours early that day, you can go skydiving, right? So experiences seem to be more important to the millennial generation even than money. And on that vein, I think the millennial generation is really defined by experience and authentic connection. So something Jeff Moore said to me once is when you get out into practice, you're going to have a lot of pressure to get really busy, right? You're going to be offered to see one patient an hour, and then it's going to become one patient every 30 minutes, and then one every 15 minutes, and then two every 15 minutes, right? As soon as somebody finds out that you can surf, they're going to put a lot on your board, right? So to resist that, he told me, get good, not busy, right? Someone with a 2-month waiting list, somebody that sees 3 patients every 15 minutes, that's not a sign of being a good clinician, of being a successful clinician. That's a sign of a poor business operator, right? That person needs to hire more employees, right? Not see more people. So get good, not busy. And I think this generation, more than any, is defined by more emphasis on quality than quantity, right? I would much rather see less people in a day and get paid less money. But no one wants to offer me that in a traditional clinic setting, right? I'd much rather see somebody once an hour or once every 45 minutes and get paid less money and have that time with them, because I know that quality, as we know from the research too, that time spent just interacting with people has much more effect on our treatment outcomes than cycling people through Therax as fast as possible, right? And there's certainly ways around that. We can implement stuff like remoms to make our Therax more efficient so that we can kind of make time where it isn't in a busy clinic, but get good, not busy. Spend quality, authentic time with people. That's something this generation really values. And kind of moving on this vein as well, I think this generation is very cognizant of the effects of working a lot, being overworked, of mismanaging their health, right? We see this in the clinic every day. People who have worked 40, 50, 60 years and they're retired and their health is just in the toilet, right? They worked all this time, they neglected their health, and now they're paying for it. And in some cases, they're spending all the money they spent their entire life saving on their health care, right? They're gonna die sick and poor and basically a net zero sum of their life, which is unfortunate as hell, right? That's scary. That's kind of the pop health crisis that we're going through right now. I think this generation is very cognizant of hey, I like working in your clinic, but I like not working in your clinic too. I like to do other stuff besides be a PT for 50 hours of treatment time and 20 hours of documentation time a week, right? I like to go do other stuff. Being cognizant of that and in conjunction with the quality care that we know matters according to the research. And so fusing fitness athlete and organizational management and some pop health discussion today, I want to hit on this article that just came out. I realize now that it's backwards. This article is cardiac autonomic and blood pressure responses to an acute foam rolling session. So don't turn me off because I said foam rolling. I know. Another foam rolling article. Foam rolling, does it help us be more flexible? Does it help our muscles? Like if we research cancer as much as we research foam rolling, we'd probably cure cancer, right? But this article is a little bit different. So this is from the October 2018 edition of Journal of Strength and Conditioning Research by Lastova and colleagues. Sorry Sorry, Kevin Lastova, if I butchered your name. So this article is a little bit different, right? It's not looking at flexibility or muscle length or any of the kind of stuff we've pounded into the ground with foam rolling in the past. This article is looking at the effects of foam rolling on blood pressure and heart rate variability. So looking more at the autonomic nervous system and the effects of spending some time on some body work on yourself and kind of the effect it has on your sympathetic nervous system, caring a little bit less about kind of the musculoskeletal effects of range of motion and muscle length and that sort of thing. So this article has limitations. The N was only 15, but basically 15 people, 8 guys, 7 gals, laid in a quiet room. They foam rolled their adductors, hamstrings, quads, IT bands, calves, lower back, and upper back. So 7 regions, 2 seconds up, 2 seconds down on the roll, 10 reps, so about 5 minutes of foam rolling. They took 1 minute rest in between, so about 15 minutes of foam rolling. And what the article found was there was a statistically significant difference in systolic and diastolic blood pressure and an increase in heart rate variability. So these people were in a quiet, temperature-controlled room. They were instructed on how to do foam rolling, and they were kind of just left alone for 15 minutes to do some foam rolling. And I think, if I look at this article with an objective lens, I like that it increases heart rate variability, right? I'm really into heart rate variability research. But I think if I had to judge this article, I'd say, was it the foam rolling for 15 minutes? Or was it the fact that people got 15 minutes to themselves in the middle of a day in a quiet room where they don't have their phones, they don't have their kids, they can't check their email, they're just chilling out for 15 minutes, right? I would guess that if we redid this study and just had people lay down after a workout for 15 minutes in the middle of the day in a quiet, temperature-controlled room without their phone, we might see similar results for their blood pressure and heart rate variability, right? Just taking 15 minutes out of your day to do something besides work, which with technology and stuff, we're always connected to work now. I know I'm guilty of that. I'm answering emails pretty much 20 hours a day if I'm not actively doing something else. So CrossFit here is my 1 hour a day where I can't check my phone. And so I think having that time to yourself, even 15 minutes, is kind of more related to improvements in health, and I see that as kind of an embodiment of the millennial generation too, taking time out of your day, spending some time on yourself, and not spending every second of your life at work. So this was an experiment trying to tie in a couple different topics today. So we talked about who are millennials, we talked a little bit about the debt that they faced, we talked about quality care and authentic experiences, and we talked a little bit about foam rolling and its effects on blood pressure and HRV. So as a millennial, I think, I like to work hard, but I think having cool experiences, authentic connections, and time for yourself is just as important as working hard. I think we have to, and I'm not going to say work-life balance, so I'll stop there. I won't say it. So overall, millennials, not a bad generation. Courses coming up. Jeff is flying up to Washington right now. If you're in Washington State, check out the Washington Physical Therapy Association conference. He's doing the pre-con course today and tomorrow. Not this weekend. Next weekend, Eric's in Marquette teaching extremity management. Jeff is in Covington, Louisiana, which is right across the bay or the bayou, on the bayou, from New Orleans, teaching lumbar management. The weekend after that, Zach and Megan are in Phoenix for clinical management of the Fitness Athlete Live. That same weekend, Mitch and I are in Argyle, Texas, which is outside of Dallas, also teaching Fitness Athlete Live. The weekend of the 20th, Eric is back with Extremity in Philadelphia. And then the last weekend of the month, Mitch and I are going to CrossFit Mayhem for an aerobic capacity course. So if you're down in Tennessee, come on over to CrossFit Mayhem and meet us. And then finally, the first Saturday in November, pretty busy weekend. Jeff is on the road again in Santa Barbara for cervical. Mitch is in Smyrna, Tennessee, which is outside of Nashville for Fitness Athlete Live. Jessica is up in Portland for performing artist management up there at New Heights Physical Therapy. So lots of courses packed into these last 2 months of the year. Pretty much mid to late November, we are winding down for courses. So if you want to catch us before the new year, if you want to get into one of our online cohorts, now is the time, because the end of the year is coming up quick, as weird as that is to say. So have a great day. I'm going to go get showered up and go get out to the clinic. So no 8:30 Car Talk Radio from me. Have a great day. Have a great weekend. Get after it.